Alexa, stop. Okay, I gotta get dressed.
I have a sense of guilt sometimes when I'm at home and I'm browsing Twitter and I'm seeing all this work going on and people being in the lab 24/7, and I almost feel like I'm not doing enough. I'm working more than I usually work, which is already quite a bit. 10 to 14 hours a day, probably. We're trying to protect humanity from a number of diseases. My goal in life is to contribute to that. I grew up in South Africa, and while I was there, I had encephalitis as a child. And so I think since that experience, I've always been curious about viral diseases in particular. When I moved to Seattle to start my postdoc, there was a Zika outbreak, so I worked on a vaccine for Zika at that point. But of course, those diseases never reached the global proportion that we see today with COVID-19. We could study it right here in our backyard. That's exactly why I'm drawn to science, is the opportunity to work on things that we don't know a lot about. What I have been working on for the last 4 years is what's called RNA vaccines. So RNA is basically a piece of code, like you would think for software engineering. And so we can encode the sequence for that protein, and we can deliver that RNA directly into your cells. And your cells will basically become this manufacturing facility and produce the protein in your own body. And now your immune system can come and interact with those proteins. And ideally, those antibodies will neutralize the actual virus if you ever come into contact with it.
So it went from clear to somewhat white and milky. And that's because the RNA is interacting with the formulation and the particle size is growing.
RNA vaccines that are currently being used in humans as a product, 0. COVID-19 could potentially be probably one of the first RNA vaccine products if it makes it past all 3 of the clinical trials. There's definitely more urgency at this point. The time that it takes to develop a vaccine, it's historically 10 to 20 years. The fact that we're trying to do this in 1 to 2 years is a huge change. Since the outbreak, though, ferry schedule has been all messed up, and so my time in the lab is shortened significantly. I'm trying to do this work, but at the same time, I'm also trying to maintain social distancing so that I come home to my family. I want to make sure that my family's safe.
Hi, Dad.
Oh, hey guys!
I have a 3, a 6, and a 9-year-old.
What did you guys do today?
I don't fully comprehend what's going on. My son the other day was so upset that he found out he's not going on his field trip. We had to tell him, there's no field trips going on anywhere right now, and he doesn't fully grasp that. But so the hardest part, I guess, is the disappointment. I haven't really thought too much about my personal reaction to the outbreak. My wife always says that she's struggling with dealing with this and how this is going to impact humanity, and meanwhile I'm just happy-go-lucky, my normal self. I'm just so focused on the work that I'm not really thinking too much about how this is impacting personal lives. Working on this and staying busy and just focusing on this is just helping me to cope. I think vaccines are going to be very important in the long run. We can maintain social distancing and we can continue to flatten the curve, but if we resume normal daily life activities, we're very likely going to see us increase in case counts again. I think vaccines are essential to protecting the human race from infectious diseases, period. I guess it's definitely opened up my eyes to the fact that we're pretty fragile. We can definitely be rapidly impacted by something as small as a virus, right? And definitely makes me feel like I've chosen the right field.
Comcast Washington is proud to help our neighbors stay connected.